Very nice to see you all here again. For those of you who came here last year, this is our second annual conference. Very pleased to see you. We're also lucky enough because we have about 200 people watching online, so I'm going to wave hello. This morning's sessions are going to be live streamed. So if you're at home and can't access this afternoon, don't hit the screen. We've switched off at lunchtime. Just a bit of housekeeping to start off with. The Wi-Fi code is in the event program and on the screen, I think. No, it isn't on the screen, but it's in the program. And for Twitterers, please tweet away. And the hashtag is the rather generic hashtag HFEvent 2018. We're not expecting a fire alarm this morning, so bombing where 22 people lost their lives. So what's going to happen is that at 2:30, the venue here over the tannoy is going to signal that the time for a minute's silence, and we thought that was probably the most respectful thing to do on this first anniversary. So a minute's silence to remember those people who lost their lives. Okay, so that's the end of the, on the minute silence, that's just a minute before we go into the breakout sessions after tea. So perhaps if you could just stop where you are and we'll start the sessions a minute later. Okay, so last year's conference, we focused on how to develop the National Health Service into more of what we called a learning healthcare system. That is, faster discovery at the front line to make improvements to services. What would it take? This year, we continue on this same theme, but we look much more closely at what we are calling the human element. So what do we mean by this exactly? Well, we think that certain approaches to improving care in the NHS have been very underpowered, and they need to be dialed up. For the last couple of decades, we've relied, as you know, a lot on planning, targets, directives, regulation, payments to make progress, to nudge the system. There have been a lot of other things too, but that's been the prevailing zeitgeist. And there has been progress. Even in the last decade, as investment in the NHS has been about 1/4 of what it's traditionally been, and also with cuts to social care. Progress, like better outcomes, heart disease, cancer, stroke, for example, and generally high public satisfaction with the service, although there's been a dip recently. And also greater productivity. Some of our analysis published today shows that while emergency admissions have risen by 3.2% over the last decade, beds have only increased by 0.3%. More older and sicker patients being admitted, and yet their length of stay has been cut by 1/3 over that period. So staff are working a lot harder. So we all need more from the NHS. We want the best possible treatment, support to stay as healthy as possible, and very importantly, care with a human face. And that's whether we are staff or patients. But, as we all know, given the limp state of the economy, pressures on health spending, and all the very exciting new technologies stacking up on the horizon, what are we going to do? We can see the limits of our usual, more top-down approaches. What more can we now try? So the human element. Let's leave aside orders, tech, payment, regulation. They all have their place. And let's look more at the conditions in which the intrinsic motivation of staff and patients might flourish a bit more. Probably like you, I can remember working in environments where any talent you had was hemmed in. It was reduced, it was ignored. In my case, the medical firm where the consultant taught medical and nursing students through ritual humiliation. The master of the universe manager who transmitted but didn't receive signals. The dysfunctional stress team. If we experience all of these things as staff, so will patients. But we also know there were many other environments where the opposite was true. The team that was inspiring, the boss who always backed you, sometimes at cost to themselves, The culture which helps you connect and empathise with patients and go the extra mile to make care better for them in ways that they valued. The support your team got to develop improvement skills to make that one change you all wanted to see. And maybe that's why 58% of staff last year reported that they worked beyond their hours for no extra pay and came into work when then they weren't entirely well. And that's also why 1 year on we remember the victims of Manchester, but also the staff, the commitment of staff that was absolutely demonstrated in Technicolor on that day. So, the sorts of questions today we're going to look at are: how can NHS staff be supported to make more improvements in the current squeezed environment? What types of issues do we as patients experience in receiving care? How can these issues be more centre stage than they are? Why is supporting the workforce a viable investment proposition, and how best to argue the case for it? How can frontline staff best be supported to make effective change? What skills do they need? What evidence? What data? And if investment really is in the offing from the government in the NHS's 70th year, let's wait and see what the announcement might be, what would a better national strategy with more of a human element really look like? So these questions are far harder to answer than how much investment does the NHS need, how to pay for it, and which new tech is going to save the day. Which is why we're majoring on this subject today, the world of humanity and staff. And there are a lot of goodies on the programme. So what we have is this morning we have a set of plenary sessions, and after lunch there are concurrent sessions, and then we end with a keynote discussion after tea time. But before we start, and I introduce our main speaker this morning, I'm just going to do a shameless bit of advertising. First, many of you know the Health Foundation. We've majored a lot in the last few years, last decade actually, on quality improvement in healthcare, in particular safety. And more recently, we continue in this vein because it's so important, supporting frontline staff. But we've also done a lot of policy analysis. So much so that we're often now referred into the press not as an endowed foundation but a think tank, which is quite interesting. And we've also moved far more now into looking at health. So check out more of our work in future on that subject, population health. Just a few more adverts. Check out the series of papers we've worked with BMJ on how to improve quality in healthcare delivery. We kicked this off this week, this series, in the BMJ. Complimentary copies are outside. And thank you to the BMJ for being our media partner for today's event. Also check out my colleague's fantastic analysis of emergency admissions, which we published today, and it's on our website. And later this week, keep your ears open for our analysis with the Institute for Fiscal Studies on future funding projections for health and social care. This is to support the NHS Confed's work on the future of the NHS. And finally, probably most importantly, you may need funding to get your improvement ideas off the ground. Check out our website for grant opportunities and other goodies. For example, information about the Q community, which is a group of now over 2,000 people across the UK supporting each other to try and make change. A lot more information on our website and outside in the reception area. Okay, so that's the end of the advertisement. And I'm really delighted to say that we are going to kick off with Matthew Taylor, who's the Chief Executive of the RSA, which is the Royal Society of Arts, but also Manufactures and Commerce, so it's quite a wide brief. Matthew, as many of you know, is very famous, and he also led a recent review of modern working practices, not least in the UK's gig economy. And his sonorous tones are often heard on Radio 4 on an impossibly wide range of subjects on which he's extremely knowledgeable. Anyway, he's been thinking a lot about what is good work, which I think is the centrepiece of our discussions today. And Matthew, over to you. Thank you.